For centuries, tuberculosis was called consumption, not because it killed quickly, but because it slowly consumed the body. People coughed for months, lost weight, faded away. In the 18th and 19th centuries, tuberculosis accounted for up to 1 in 4 adult deaths in parts of Europe and North America. No cure, no proof, only fear and isolation. Tuberculosis is older than modern civilization. Evidence of TB has been found in ancient Egyptian mummies, in skeletal remains from India and China, and even in pre-Columbian South America. Ancient physicians called it phthisis, to waste away. During the Industrial Revolution, overcrowded housing, poor ventilation, and malnutrition turned TB into a true urban epidemic, earning it the name the White Plague. Everything changed on March 24, 1882. German physician Robert Koch identified the organism, Mycobacterium tuberculosis. For the first time, tuberculosis was proven to be a bacterial disease, not hereditary, not moral, not inevitable. This discovery helped establish germ theory, transforming medicine, epidemiology, and public health surveillance worldwide. Tuberculosis spreads through the air. Microscopic droplets released when a person with active TB coughs, speaks, or breathes can carry the bacteria deep into the lungs. Once inhaled, Mycobacterium tuberculosis reaches the alveoli and is engulfed by immune cells called macrophages. But unlike many bacteria, TB can survive inside those cells. The immune system responds by forming a granuloma, a structured containment wall meant to trap the bacteria. In many people, this works. The infection becomes silent. This silent state is called latent tuberculosis infection. There are no symptoms, no cough, no fever, but the bacteria remain alive. An estimated 1/4 to 1/3 of the world's population carries latent TB. Only a portion will ever develop active disease, but if immunity weakens, the containment fails. The bacteria reactivate, multiply, destroy lung tissue, and become contagious. The mid-20th century brought hope. Antibiotics, such as streptomycin, followed by isoniazid and rifampin, transformed tuberculosis from a death sentence into a treatable disease. But TB is slow-growing and difficult to eradicate. Treatment requires multiple drugs taken together for at least 6 months. Stopping early doesn't just fail. It fuels resistance. When treatment is incomplete or inconsistent, TB can evolve. MDR-TB resists first-line drugs. XDR-TB resists even second-line therapies. These forms are harder to treat, more toxic, and far less successful. Globally, drug-resistant TB remains a major public health challenge, particularly in regions with limited healthcare access and high HIV prevalence. According to the World Health Organization, tuberculosis remains one of the leading causes of death from infectious disease worldwide. Millions develop active TB each year, and over 1 million still die, despite effective treatments existing. In the United States, TB is far less common, but not eliminated. Higher risk groups include immunocompromised individuals, people with diabetes, those living in crowded conditions, recent travelers from high-incidence regions. Tuberculosis never disappeared. It adapted. It learned how to hide inside the immune system. It learned how to survive incomplete treatment. TB is not just a disease of history. It is a reminder that medical progress only works when science, public health, and adherence move together. This is the disease that never left. Follow for science-driven history, real biology, and public health stories that still shape our world.